Hello, my name is Ashley Strickland. I am one of the students of the master's program. I am completing my project on screening of a disease, and my population I chose was adolescents. Adolescence is a transitional phase of growth and development between childhood and adulthood. Who defines an adolescent as any person between the ages of 10 and 19, This range falls within WHO's definition of young people, which refers to individuals between ages 10 and 24. Today, adolescents make up 13.2% of the population. As the U.S. population ages, adolescents will represent a smaller portion of the total. By 2050, it shows that the adolescents will make up 11.2% of the population. The breakdown between suburb and rural areas, the adolescent population is more racially, ethnically diverse than the general population. More adolescents live in the suburbs than in rural areas in central cities. Um, this just shows the breakdown of the ages between 10 and 19 has increased by 16.6% in the years of 1990 to 2000. Here's a breakdown of healthcare in rural areas for adolescents. Um, you know, Continuous healthcare for at least 12 months in 2015 and 2016, while 5% were insured for less than 12 months and 2% had no insurance at all. In 2017, 3% of New York State children 18 and under were without health insurance. Through private and public health insurance, adolescents have a high rate of coverage, 95% or younger for younger adolescent age 10 to 14 and 92% for teens aged 15 to 18. Insurance coverage and doctor visits have increased since the Affordable Care Act, especially among the low income youth. I chose to do my project on STD rates, gonorrhea, screening for gonorrhea in the adolescent stage. Um, there's roughly about 20 million new STD cases reported every year. Half were among young ages 15 to 24. Although this age group makes up only 25% of people who are sexually active, it's still a big, huge chunk. Um, Rates of chlamydia and gonorrhea among male and female teens aged 15 to 19 have been climbing since 2013. Gonorrhea, just a little background, everyone knows, is a sexually transmitted disease that can affect both men and women. It can cause infections in the genital rectum and throat. It is very common infection. It ranges from young people ages 15 to 24. It can be transmitted vaginally, anally, or through oral sex with someone who has the infection. It can also be passed during birth from an infected mother to a newborn. Here's just some symptoms of gonorrhea. You know, with the men, burning sensation when urinating, white, yellow, or green discharge from the penis, swollen testicles. With women, increased vaginal discharge, vaginal bleeding between periods. Here's a little statistics. 2015 and 2016, the rate of reported gonorrhea cases increased by 11.3% for persons aged 15 to 19 years of age and 10.9% for persons aged 20 to 24 years of age. Risky behaviors. Sexual exploration is a natural part of adolescent behavior. Early initiation of sexual intercourse and multiple sex partners without a condom and incorrect use of condom increases the risk of poor outcomes. Primary prevention. Primary prevention is pretty much improving the overall health of the population. This level, the advanced nurse practitioner evaluates, researches the statistics, prevalence of gonorrhea, and the numbers reported by the local health department. The secondary prevention, providing just early detection, providing education, providing the resources for education. And in the rural areas, there's not enough resources and education when it comes to practicing safe sex. The tertiary prevention, preventative measures, providing education and retraining of the prevention. Sometimes, we need that extra step. Let's retrain, let's re-educate, let's provide measures, where to go when you have these symptoms, what to do when you have these symptoms, how to not get these symptoms. In this level, the advanced nurse practitioner will supply the adolescent on information needed for prevention and treatment, provide the adolescent with the proper places for treatment and also prevention. Unintended consequences of this screening: uncovering other STDs, finding pregnancy in females. There are times there are false negatives of screening and false positives of screenings, as with any test. I hope you enjoyed my PowerPoint. I know I sound a little stuffy, but I have allergies, but thank you for listening.